We continue to call on countries to find, test, isolate, and care.
Testing is essential to tracking and containing the coronavirus pandemic. They fulfill the most basic task in disease control, identifying the sick and separating them from the healthy people. In the race to get a handle on the pandemic, a number of tests are now in use around the world. But how do they work? COVID-19 tests broadly fall into two main categories. Let's first take a look at the diagnostic tests. This check for an existing COVID-19 infection. Samples are taken from your respiratory system, usually a swab from deep inside your nose, and tested to see if they contain the virus. The most well-known one is a molecular test, such as RT-PCR. This one looks for the virus's generic material, or RNA, in the sample taken from your nose. It's considered to be highly accurate, and the best time to do it is 6 to 8 days after infection.
Early on in infection, sometimes the sample might be falsely negative because there might not be a lot of virus present to be detected.
The other way to detect an active infection is what's called the antigen test. This one looks for the proteins that are found on the surface of the virus. But it has shown to be less effective, as it often gives false negative results. The second category of tests are the antibody tests, also known as serology tests. These look for a past inactive COVID-19 infection. What they're looking for are antibodies that are produced by your immune system in response to a viral infection in order to protect you from getting the disease again. But these tests tend to be a bit tricky. False positives can happen, especially if you've got antibodies from another virus of the coronavirus family. For example, if you've had a cold.
Certainly there could be cross reactions with other coronaviruses, and you can't look someone in the eye and tell them with a straight face that was COVID-19, because there are there can be false positives associated with the antibody test.
Also, it turns out that many people who've had prior infections get false negative results with the antibody test. This can happen for various reasons. First, it can take around 1 to 3 weeks for your body to make antibodies after you've been infected. And the volume of coronavirus antibodies drops sharply once the acute illness ends.
The goal is to really identify who is most likely to transmit this infection. Like, there's a lot of people that have recovered from COVID-19 that can go back to work. But the problem is their PCR test will still be positive.
Dr. Boger says that what we need are saliva-based rapid tests, something that would resemble a pregnancy test.
We really need those. They're not really around yet, but they're in development.